you got your 6-year molar coming through. Nice.
Christina Pellegrino and her son Cole are in for their regular dental checkup and cleaning.
As a parent, you don't have to, fight with him to go to the dentist. It's never once that. It's always, oh, Mommy, can you call Dr. Fazio? He wants to go.
Okay. And how old are you now, Cole?
6.
6. Okay. When are you going to be 7?
When you want the best for your kid, you will go where it's the best for your kid.
For a growing number of parents, holistic dental care is in tune with living a more healthy lifestyle and protecting their family from potential health problems later in life.
A lot of our parents come to us with concerns if their child has cavities. People may have the ideal perfect diet with limited sugars, limited sweets and candies and stuff, and a lot of parents can't understand, why does my child have cavities?
And the answer is that it's not just sugar that's the culprit. So taking that out of the equation doesn't always guarantee that a cavity won't form. And that's why we'll tend to query the parents on more of the lifestyle things that are going on there. Okay, so it's one thing to have a clean diet, which always helps, but it's another if there's poor brushing habits or poor oral hygiene, which we know is also critical. But then there could be genetic factors that may be playing a role there, where a child growing up in a very clean household is developing cavities because their saliva doesn't have the capacity to buffer acid formation, or doesn't have antibodies secreted in it that help fight the bacteria. So some children are already born at a disadvantage.
Thinking outside the mouth is what holistic dentist Dr. Len Fazio does for all his patients. Dental care using holistic methods at an early age can help delay or even prevent serious dental work later on.
Sometimes we'll get patients in here who aren't at a point where we see cavities that need to be treated. Let's say it's the very beginning stage, or the cavity's only in the outer enamel layer. If we do catch it early in the enamel layer, then one of the ways that we can manage that situation is the topical application of ozone, oxygen and ozone in gas form. The gas will very readily penetrate that layer of enamel and get to the caries that are hanging out in these grooves and sterilize them, kill them off. And then the remineralization can occur, and perhaps we never have to do anything. So if we can stop it dead in its tracks, then that's the ultimate thing.
We're not necessarily immediately going to resort to drilling and filling teeth. We like to look at the child's mouth, maybe recommend certain xylitol products, certain probiotics, all different types of pH neutralizing medicaments that we can have our patients try to help remineralize and hopefully arrest the decay that's in their mouth.
In general, more patients prefer to filter the fluoride out of the water and use fluoride-free toothpaste for their daily dental hygiene regimen. Holistic dental prevention looks to counter oral acidity by neutralizing pH levels in the mouth and body. Here, xylitol is used instead.
And the way xylitol works is by changing locally the pH in the mouth and guarding against acid formation. That can be delivered in the form of xylitol-containing chewing gum, or gummy bears that are loaded with xylitol, or even other lozenges for older children that they can use as a means of keeping that oral pH in a more pH neutral environment. There are other ways of addressing body pH, so we have these conversations a bit about the kind of foods that are being included in the child's diet. If we recommend to mom and dad to include some leafy green vegetables, or perhaps make it even more conveniently located in some sort of green powder, which a juice could be made from, then it helps alkalize the body in general, which eventually alkalizes the pH and therefore makes it harder for cavities to form and to progress. We go on the assumption that teeth have the ability to heal themselves. And if we catch the teeth early enough, or I should say if we catch the cavities early enough, we expect that by employing some of these strategies that we might be able to get the tooth structure to remineralize, and that we arrest or stop the progress of cavity formation, so much so that either the child never needs work, or that we buy some time and delay the institution of treatment until the child is older and more cooperative.
He was maybe 6 months, and that was it. We just started bringing him over and getting him adjusted to the environment, and they have this bond that you just can't even question it. He loves them, he gets the work done, and we do a lot of work And it's priceless.
I think our new parents or new patients are most excited about that. They're not getting the same old bad news. Yes, we can inform them that there may be cavities that need addressing, but that there's an alternative now, that we can manage this differently rather than going right to the drill and fill mode and subject the child to either the emotional trauma of having their teeth drilled on, especially when they're so young.
For Push Pause in Port Jefferson, this is John Schwally.